And hello and welcome to another episode of Medicine Mondays. I am yours truly, Dr. Pierre, favorite board certified internist, host of Medicine Mondays, the Lunch and Learn with Dr. Barry podcast, the Dr. Pierre's Health Checks, which is our other YouTube page. Make sure you check that out. And before we begin everything, make sure you like, subscribe, and hit the notification bell to make sure that you're aware of every new video that drops here on this page. I am yours truly, Dr. Pierre, and today we are talking about the annual checkup, right? And why is that important? I know when you look on the news right now, any health-related websites, everything has been about COVID. In fact, if you look on, my podcast and my videos, we've had a lot of COVID-related discussions. Unfortunately, it is, we're in a pandemic, so it makes sense for us to talk about it. But I do not want us to forget about the annual checkup. And reason why I am focusing on it as a whole video is because what we've seen, again, like you should have known I was going to somehow tie COVID in here. What we've seen with COVID-19 is that a lot of people, whether their doctor, went to telehealth, whether their doctor, stopped seeing patients, a lot of people start going for their annual checkups. And what we're starting to see now, some data is starting to show up now, is that a lot of people are missing their routine screenings. A lot of people are missing their routine labs, medications not being refilled. So we really have to get back in really, I guess, the norm of things, right? Especially when we come to think about our healthcare. Again, like I said, yes, COVID-19 is here. We're in a pandemic, but we cannot forget that there's a lot of other diseases on top of COVID-19 that if we don't take care of those can be much worse, right? I want to focus on what to kind of expect going into the annual checkup, right? So of course, as a male, right, like there's different things to expect as a man, there's various things to expect as a woman, right? And I'm obviously, as an internist, I'm talking about older adults, right? I don't know what kids are expecting, right? Because again, one of the reasons why I went into internal medicine, so I do not have to deal with like the kids related health problems. So we're talking about it from the adult perspective, what to expect going into your annual checkup. So I'll start with me. When I go, and first of all, when we think about when should we go, again, annual checkup is kind of in the name, once a year. Me personally, the way I remember to go get my annual checkup is because I usually do it around my birthday. So I know when my birthday is coming up, my annual checkup is coming up as well too. And so that's how, especially if you're watching this video, you're trying to figure out like how to get things started. That's the easiest way to do so, right? And when we think about the annual checkup, it's not like a regular doctor's visit, right? Because typically if you go in, you have a cough, you have a cold, something's hurting, you're going to see a doctor and he or she's going to deal with that certain problem. But what that happens with the annual checkup is that we, especially as physicians, like we get together, we start thinking like, okay, based off everything that you have going on in terms of the medications you're taking, in terms of your age, in terms of your gender, I know there's certain things that need to happen, like that I need to kind of cover during this visit. So what you'll typically see is that your annual checkups are actually a lot longer than your regular visits. Your regular visits may be 15 minutes, we hope. Your annual checkup may be 25, 30 minutes, right? Because there's so much more that your doctor has to ask you, so much more that the nurse has to ask you, so much more questions that you have to answer yourself that you can't really get that done in 15 minutes. And what's the beautiful thing about it is that most insurance companies, they allot more money, right, for the annual checkup, right? And then they allot more time because they're saying, hey, you know what? We know you got a lot of things to go to. And, we know you can't stuff everything in that 15-minute appointment. And we don't want you to stuff everything in that 15-minute appointment because we know out of all of the appointments that you'll likely get throughout the year, your annual checkup or your wellness visit, what some people may call it, is the most important one. Because if you do well and getting your annual checks up and getting your wellness visits, we know that can save, especially if I'm thinking from an insurance company standpoint, that can save us a lot of money in the long run, right? So we have no problem spending some money in the beginning, giving you some extra money, some time, right, to go take care of your patient, talk to your patient, ask all of these questions, because we know that if you ask the right questions and you spend enough time with your patients, then you won't end up costing us later. So that's what usually goes. So when I get mine, again, like I said, I usually get mine around my birthday, which is around December. So I usually get in and I'm expecting to be for a while. So one of the first things that you do for every visit, obviously, is getting your blood pressure checked. And that may seem mundane. You may be thinking that you're just kind of passing the time to get to the room. But it's so important, right? Because knowing what your blood pressure is, knowing what your heart rate is, knowing what your pulse is, some docs will actually take your oxygen level as well too, depending on your history. Knowing what that is can give the doctor a lot of great information, especially when you actually do end up seeing them in the room. So that's why it's important to make sure your vitals is always the first thing that is usually picked up when you walk into your doctor's office, right? So for the annual checkup, so I like to break it up into gender and I like to break it up into age, because depending on where you fall and which category you fall in will depend on which category of things we need to do. So typically as a wellness, like I'm asking you, you know what, how is your health in general, right? How are the things that you're doing as far as exercise, diet? You get a lot of, and the annual wellness visit is really big on education, not really big on doing, even though there is some doing, but it's really big on education. All right. So I'm going to find out, you know, how you're doing from an exercise related standpoint, how you're doing from a health related standpoint. If you're on any certain medications, how are you doing with those medications? More importantly, I'm asking even mental health related questions, which is important. Like, how are you doing as far as stress? Right? How are you as far as doing depression? Like all of these things that we typically don't ask in your 15-minute appointment, because unfortunately we don't have the time, we're definitely going to ask during your annual wellness visit, right? So you'll get a lot of those kind of like deep dive questions to try to figure out what's going on with you at home, what's going on with you at your health, because we know like if we do a good enough job here, we'll do a great job towards the end of the year. So as we ask those questions, finding out, you know, again, the medication's working well, is there any issues, any stressors in your life? Again, a lot of times you may be surprised how often your doctors are asking about stressors in your life, because again, health is so multifaceted, right? Like if you're not, you know, if you're not physically fit, if you're not mentally fit, you're not spiritually fit, you're not going to do well, right? So your doctor typically will ask you, or should, right? This may be eye opener for a lot of people. Your doctor should be asking you these types of questions during your annual visit. Why? Because they have the time to do so. They get paid to do so. So they have that time to do it. So you typically get kind of those battery of questions. So it's a lot of questions that occur during your annual visit, right? So be prepared, right? Be prepared that this isn't going to be your typical appointment where you kind of run in and run out. Not this appointment here. Also, depending on medical history, there may be some physical exam things that your doctor does that they typically don't do during your regular visits, right? Especially if you're a man, right? Like especially if you're of age, right? You may be getting what we call prostate check, right? We may be assessing, you know, if you have an enlarged prostate, right? And that's just your regular general physician, right? For my women patients and women, you know, viewers and followers here, again, that's when we start asking you questions about, you know, whether your cycle is normal, or whether you have a normal cycle, or, you know, any issues with menstruation or any issues throughout the month, right? Because we know not only during your wellness checkup, right, that's when you actually start worrying about getting your pap smears and that thing taken care of. And we can have a whole conversation on making sure your pap smears and everything else is up to date. As an internist, like, yes, I know a little women's health, but I don't know a lot of women's health. So I typically will bring on a guest to talk about women's health in that regards, and we'll do so. We'll definitely make sure to kind of touch base on it, because we obviously don't want to leave such a huge contingent of the lunch learning community out, which is like I think majority of the lunch learning community members, and probably like 55-45 are women, right? So we definitely don't want to leave you guys out. So we'll definitely make sure we bring a couple specialists on here just to kind of talk about just the annual wellness checkup, especially on you guys' side. So that being said, so fast forward. So we say we do some physical exam findings. Again, we've already talked about the blood pressure. We've already got a lot of mental related history going on here. We want to kind of figure out how you do it mentally, right? Physical exam findings are for sure in that regards, right? And then just depending on the age bracket that you're in, it kind of cues us in to see, like, is there certain blood tests that I need to do? Is there certain diagnostic testing that I need to do? Is there certain specialists I need to send you to? Because it's very important, right? Especially when we think about age-related treatment course, right? Which kind of ties into your social related history, right? Whether you're drinking alcohol, whether you smoke cigarettes, all of these things there can kind of lead us towards the end, right? Because again, we're not quite at the end yet as far as what we need to do to get out of the office. Because again, like I said, it is a much more longer visit than you're used to, but we are getting there. So typically, again, depending on the age, depending on some of your social history, you may need to see some other people, right? Especially, let's say you're of age, you're like 40 years old and you've never had a colonoscopy. Guess what? Like on this wellness checkup, I'm going to send you to the gastroenterologist to get your colonoscopy. Again, we talked about if you're a woman, right? If it's time to get your pap smear and your mammogram and all those types of things there, I'm going to send you to those people to get some of those stuff is done as well too. And I think most importantly, what most people are usually aware of is kind of the blood testing that typically goes on. Now, again, what I love is that most insurance companies will cover a lot of the blood tests that typically occur during your annual visit, especially if your doctor kind of codes it correctly. Again, more technical babble, right, which we could talk to on a different level. But if your doctor codes it correctly, right, when it's during an annual visit, a lot of those blood tests are actually free. That actually are no cost to you. And again, I kind of mentioned how a lot of the insurance companies are like, hey, we'll spend this money here because we know if we take a good job, we take care of you good in the beginning, like we don't have to take care of you anyways at the end, right? So a lot of stuff is a battery of tests that we can do, right? But there's like a family of testing that would typically always gets done, and we're going to talk a little bit about that today, right? I even have, like I said, especially members, like so my Medicine Monday folks, right? We have a little props, right? So I got my whiteboard here, right? I got my whiteboard here just to kind of touch base on some of the more common tests that we always get. Like I tell you, if you're getting an annual visit, you're likely getting a lot of these battery tests. You're likely getting more depending on your medical history, but these are some of the battery tests that I would typically get. So this first one here, right, is the CBC. What is the CBC? CBC is a complete blood count. What does that tell me as the health professional? One, that can tell me if there's any signs of infection, because your CBC has a white blood cell count. So if it's low or it's high, that could be some concern for some infection or any other related processes. I've had some patients in the hospital setting that we've actually diagnosed with cancer based off that test alone. Right, based off that test alone and being so significantly abnormal, we're like, you know what, there's a high risk that you have cancer. So CBC is a very important test, which is why we always do it at everyone. A part of the CBC also includes your hemoglobin and your hematocrit. So those are your blood tests. So for all of those people who are anemic, right, you hear this all the time. Anyone who's anemic, this is the test that we do to test for your anemia and to test for how severe it is. And then the other C, right, the final C, complete blood count, is your platelet count. That's also another blood test that we show that if you have an abnormal platelet count, you can have bleeding disorders, right? We talked about the Johnson & Johnson vaccine, right? And when it got paused, one of the issues that caused it to pause is that it was causing patients to have a significantly low platelet count. So yes, platelets are very important. Like, again, if you cut yourself right now and you start bleeding, what causes you to stop bleeding is your platelets activating at that level of injury and saying, hey, you know what? Stop the presses, clot this area here so he can stop bleeding, right? So platelets are very important. So that's your CBC. CMP, that is your next testing, right? So, and the CBC can be interchangeable because some doctors will get a BMP. I like a CMP, right? So the CMP is a complete metabolic panel. And the reason why that's important, right? There's a lot of different things that occur in the CMP that I think, like that's why I always get the CMP. One, your electrolytes, and I'm talking about sodium, potassium, chloride, bicarb. A lot of your electrolytes are located in the CMP, right? So if I want to know how your sodium, how your potassium is doing, especially if I have you on certain medications that may be getting rid of your sodium and potassium, aka my diuretics, my water pills, like I want to test to make sure that like I'm not doing too good of a job. More importantly, your kidney function, your BU and your creatinine is also located in your CMP and BMP. The reason why I like a CMP, because the CMP also includes your glucose, which the BMP does, but it also includes your liver function enzymes, because not only do I want to know how your electrolytes are functioning, not only do I want to know how your kidneys functioning, I want to know how the liver is functioning. There's a lot of diseases that we diagnose strictly based off the CMP. And again, so that's why a lot of times, you guys may go to your doctor and you see that they order these battery tests and you're like, they're just ordering tests for no reason. Trust me, every single test has level of importance that we try to stress. The next one is your A1C, right? So most people may not get your A1C, right? But A1C is important if you are a diabetic. What does the A1C do? The A1C tells me how good you've been, right, for the past 3 months, right? And by saying good you've been, for my patients who are diabetic, if their blood sugar is controlled, again, if they are, documenting, again, and that may be one of the questions we ask during your annual visit, how well has your blood sugar has been? How's it in the morning? How's it in the evening? How's it in the afternoon? Like and a lot of times your patients be like, oh, my blood sugar has been great, phenomenal. And then I get this A1C, and this A1C is like 10 or 12. Normal is below 7, right? So if you're above 7, you're a diabetic, right? If below 7, you're okay, right? So like the A1C will tell me if you've been doing a very good job controlling blood sugar or not, because it actually will give me an average of how your blood sugar has been for the past 3 months. So we love the A1C. The lipid panel, most people are pretty aware of the lipid panel. That is your cholesterol, right? Again, atorvastatin, right? Those statin medications are one of the most prescribed medications in the world, right? And why is it? Because we get a test like the lipid panel to see how well your cholesterol is. And we know if your cholesterol isn't good, your risk factors for coronary disease, vascular disease goes up through the roof, right? So that's why we always try to control your cholesterol, and not only with medication. Again, diet is important. Like I said, a lot of your annual wellness visit is more education, but like I want to make sure we hit home some of these blood counts as well. If you have any endocrine related stuff, your thyroid is another test that we do. Is a pretty common test as well too, just to make sure your thyroid is functioning. And you'd be surprised when your thyroid is abnormal, especially that TSH test. When your TSH test is abnormal, you'd be surprised how many other things could be abnormal. Your platelet count could be abnormal. Your cholesterol panel could be abnormal. Your A1C could be abnormal. So having a functioning thyroid and a proper within limits is extremely important. And then vitamin D is another one as well too. Typically, again, this is where I start talking about when I say it's gender and age. If you're older in age, we know that the vitamin D, even though I think it gets a lot of fanfare now, vitamin D is very important because we know people with a low vitamin D, their risk for having fractures increases, especially after like a regular fall. And as I'm getting older and I'm taking care of older patients, one of the more important things that I'm stressing is making sure they have proper body mechanics, making sure they're walking well, making sure there's no obstacles when they're walking around their house. Because I know if they fall and their vitamin D and all these other, calcium and those things aren't correct, all of a sudden a regular fall for them now means a broken hip. And we know mortality rate increases for patients with abnormal electrolyte level, especially the vitamin D and calcium, right? So, and there's trust me, there's a slew of tests that your doctor may order, especially depending on, what type of disease process you may be having. So again, these are just kind of like, this is like the bread and butter, right? Like these right here, this is the bread and butter of testing, right? Like if you're going to get your annual checkup, your doctor should be ordering this test. And if they don't order this test, you got to ask them why, right? Again, maybe you don't need an A1C because you're not a diabetic, right? So I don't expect them to order an A1C if you're not diabetic. But a lot of these other tests are pretty bread and butter and gives the doctors and us. Oh, and one thing I totally forgot, I didn't write it down. In fact, let's hopefully you can see that's in blue. Hopefully you can see that. So that's the UA. That is a urine analysis. Again, that is the P test. One of the more important tests. Like it's not only is it one of the more important tests, it's a cheap test too, because you'd be surprised how many people that just by doing the urinalysis, I can see that like, oh, they're diabetic or they're having kidney problems. Like all of a sudden this urine test that you think is just like, oh, they're just making me pee in a cup. No, it's extremely important for us to be able to diagnose diseases across the board here. So yeah, I can't believe I forgot that, because that's definitely a test you better not be leaving your doctor's office without, because if you're a diabetic, we best want to know how well you're doing, right? Because if you're diabetic and it's causing problems to the kidneys, guess what? You start spilling your sugar into the urine. Guess what? We can check that. If you're having kidney problems, guess what? You start spilling proteins in the urine. Guess what? We can check that. If you have blood in your urine, right? Maybe you're having some, again, I've diagnosed cancer based off the urinalysis, right? So again, I don't want to sugarcoat, right, or hyperbolize that this is the most important test, right? But this is definitely one of the more important tests, especially because it's one of the cheaper tests that you can do that everyone can kind of get. So again, that is my battery of testing here, especially from a lab perspective. Like I said, I like to get, especially if you're of age, I like to get like a baseline EKG as well, just to make sure that heart is functioning, make sure there's nothing I'm missing there. If you have a history of smoking, we may get a chest x-ray, make sure and the guidelines actually show that if you're of age, I can even order a CAT scan, which is a much more detailed picture of your lungs, just to make sure we don't miss lung cancer, right? And then we talked about some diagnostic imaging such as colonoscopies as well too, especially if you're at the age of 40, right? Or if you have some family history that may cause you to go a little bit earlier, right? So again, this is your annual, I'll move this out of the way. This is your annual visit, right? Like I said, a lot of things go down on the annual visit, and I know COVID has really put a lot of things in the back burner, but I don't want that to occur. Not with you, right? Like I don't want you to, miss up and, take the wrong medications or stop taking your blood pressure medications because you don't think it's doing anything to you, right? Like again, we talked about blood pressure on the last Monday, Medicine Mondays, right? We know how important that is, right? So the annual checkup is just as important, right? And that's why I'm here to stress it again. Make sure if you have not gotten your annual checkup and you have the opportunity to get your annual checkup, make sure you get that done. If you let's say you don't have a primary care physician, go to your local health department as well too, right? Just get these annual, because again, it's nothing is more disheartening, right, than me having to, especially in a hospital setting, me having to diagnose a person with a heart attack, diagnose a person with cancer, diagnose a person with kidney failure, all of these things there that could have been caught if they just had like a regular checkup 5 years, 10 years down the line, right? Nothing is more depressing in a physician, especially one who works in a hospital setting, eyes, if by us missing it, right? Because that is a system problem, right? Like that's not a you problem, that's a system problem. Some part in the system messed up that we didn't catch you in time, and unfortunately now, right, things may be too late, right? Now your kidneys may be gone, your liver may be gone. Like we got to do better, right? And so that's why I wanted to stress this week. Get your annual checkup, especially if you hadn't got one. I was talking to a friend of mine, and I asked them, like, hey, especially because, and they're around my age, right? So I'm like, hey, did you get your wellness check yet? They're like, no, I haven't got it yet. Started giving me some excuses, right? And I'm like, no, I don't want to hear it. Get your annual checkup, like ASAP, need it done, right? Because again, it's like I said, especially in the career field, right? Where you could work, but if you don't take care of your health, it don't matter. Look at Steve Jobs, right? Creator of Apple, right? Like he could work, but unfortunately still succumb to some medical related diseases, right? Health is super important. Obviously, like that's why I'm here to talk about it. So you guys be blessed. Have a great week, and I'm going to see you guys next week on this episode of Medicine Mondays.